Back now on Triad Today, we're going to spend a few minutes talking about stroke, being aware of stroke, the signs and symptoms and treatments, and we do that with a good friend of ours who's been on the show before. We always like to have her back. Debbie Moser is, of course, among other things, a nurse. She's Director of Staff Development and Stroke Coordinator at Northern Regional Hospital in Mount Airy. Good to see you again.
Thank you. It's nice to be back.
What are the risk factors for stroke?
There are several, but the three main risk factors are high blood pressure and diabetes and high cholesterol, and also atrial fibrillation, which is an irregular heartbeat. That is one of the very highest risk factors for stroke.
And usually people that are in AFib and some other conditions, they keep up with that anyway with their doctor. But as far as high blood pressure, a lot of people don't go regularly to have that checked, right? And they should.
Right. And I see people over and over, you check their blood pressure and it's high, and they say, oh, it's okay. It stays that way. And then you have to do patient education to explain that that creates long-term damage to let the blood pressure ride that high.
Right.
It damages the vessels in the brain.
Another good reason to at least go, once a year to have,
absolutely,
if not more. What are some of the symptoms that you would see in someone that is having a stroke? How would you know?
Well, we use the Be Fast to teach everyone about strokes. So the B stands for balance. It's a sudden loss of balance. People get confused and they think they have vertigo.
Right.
The magic word for stroke is sudden. Any stroke symptom is going to have a very sudden onset. And so balance is one of the things people can't. They say they feel like they're drunk when they're walking.
Right.
The E is for eyes. They have a blurred vision suddenly or a loss of vision in one of the eyes or the fields. F is for face. You look at their face and ask them to smile, and one side of their face may be drooping. A is for arm. You ask them to hold their arms out like this for a few seconds, and you may see one of the arms drift.
Gotcha.
S is speech. You ask them to say something like, you can't teach an old dog new tricks. They may say a different word like truck. And they get very frustrated because they know what they want to say, but they can't get those words out.
And this happens suddenly?
Very suddenly, yes. And T is very important. It's time. We have to know the precise time that these symptoms began. I want
to circle back to time in a different way in just a second, but first, when you come into an emergency department, emergency room, I mean, who would assess whether you're really going through that or not?
We train everyone from the registration folks at the front door. If the patient comes in and says anything remotely related to stroke symptom, they're immediately routed to our triage nurse and then taken directly back to a physician. If the ambulance is bringing the patient in, then they will screen the patient and let us know prior to arrival so that our team is always ready.
And the most, again, I promised I was going to circle back to time. Why is it so important for someone who thinks they're having a stroke or is having a stroke, for they or their family member or loved one, to get them to the hospital or call the ambulance or something quickly? Why is the time factor so important?
Because one of the primary treatments we give, with a stroke that's caused by a blood clot, we have to treat that with a clot buster drug. And that drug is very powerful, and it has to be given within a specific time frame, within 3 to 4.5 hours of the onset of symptoms. And if you go outside that 4.5 hours, you can actually cause a patient to bleed in the brain. So we have to be very, very careful. The sooner the patient gets to the hospital, the better the outcome they're going to have, because the sudden symptoms begin when the blood flow to the brain is suddenly occluded.
Right.
Brain cells begin to damage then. If it's a large occlusion, you lose 2 million neurons a minute. 2 million neurons a minute. So we have to limit that damage to the brain.
Very important to get in quickly. I want to put up on screen, choosenorthern.org is the general website, choosenorthern.org for all sorts of information. Please get checked out. Don't fool around with this if you think you're having those symptoms or if your loved one is. And Debbie, I appreciate all the great information. Hope you come back soon.
Thank you.
All right. We'll be right back after this.